I'm very interested in putting the gender lens on the issue of suicide because we're dealing with issues of inequality. You've raised issues of human trafficking, sexual violence. And it's been raised a number of times, and we see it in the national media now, about sexual abuse of children leading to issues of suicide. But when I call in various areas to try and find out, talking to police, talking to the frontline workers, they don't have the data because they say we don't have the resources. So have you found that this is the problem? How are we going to protect children if we don't have the teams that can actually qualify to go in and do this work in the various communities?
There is no way of doing so. I believe this is the question. There is no way of protecting them unless there's people to do the work. So I think it's a question that needs to be addressed immediately.
Yeah. This is one of the reasons we push so hard for the government to finally be in compliance with the Human Rights Tribunal. That money, the government said, was like confetti. They didn't want to throw it around, but that's money that goes to the frontline workers who are dealing with the child protection right now in communities where we don't have those workers. So I'd like to follow up with you on that later. I'm interested, though, in the issues of what resources are there for women facing sexual violence in communities. We have the murdered and missing inquiry that's underway that will certainly raise a lot of questions. But I'm looking at the documents the government tabled at this committee. They have only planned to build one shelter a year for the next 5 years with nothing offered in the far north for the Inuit. So is that even close to being adequate in terms of the need of women at risk?
No, it's not even, certainly it's not anywhere close to being enough. It's nothing less than a crisis. I mean, there's services, basic services that are needed immediately. There is enough research, there is enough information. We don't need more pilot projects on this. We need adequate services immediately and the resources for that. How can we ask the women, how can we ask them to wait for those their basic human rights, their basic services? These are not luxuries. These are something that in the city people have access to, and we need those services.
Right. I was looking at the Health Canada, because we had the minister here today, and their travel policies for non-insured health benefits. And we've been flagged this by doctors about how many serious issues they will not cover travel for, but it says specifically that under no circumstances will they provide transportation for a woman from an isolated community to an interval or safe house. Why do you think government would actually identify women in crisis as something that they would absolutely not fund to get them into a safe situation?
Not sure why they would do that, but I think we would see it as a fundamental breach of human rights and a breach of services, equity in services.
Yeah. I want to go back to the issue of the child welfare ruling and the sexual predation on young children, where we just saw the BC Advocate October 2016 review of sexualized violence of children who were brought into government care, that 61% of those who were found, that they actually found, and so the numbers may be higher, but 61% were Aboriginal girls, even though they were only 25% in care. So these are children who are supposed to be made safe by the state, who are taken from their families and are subject to sexual exploitation. And then, of course, we have the examples of the ones who end up on the street, who end up in human trafficking. Can you talk about the importance of getting that funding in and what it means in this broken child welfare system that young girls are being victimized when they're supposed to be being protected? And the cycle that leads to in terms of all the other social problems.
How critical it is to get that funding in?
Well, just in terms of, are you surprised? I mean, these are children taken from their families. They won't put the resources in with the family. They say they'll take them out and put them into foster care, and these children are being sexually abused. And we saw Tina Fontaine ended up on the street. We saw Renelle Harper, who had to leave home to go to school but got assaulted. Taking children from their homes is the government's supposed to be protecting them, but they're being subject to this level of sexual violence.
welcome. Again, like the Native Women's Association supports Cindy Blackstock's position, and we believe that funding is immediately needed, and it's a crisis situation. It's a humanitarian situation, and the money should be put in place immediately to correct these types of problems that are happening, protective mechanisms, and I don't think there's any other way other than putting the money immediately to where it is immediately needed.
Right. I want to go to the Thunder Bay inquiry raised a lot of really disturbing, the Thunder Bay inquiry into the 7 youth who died, but issues of young girls who have to leave home at 14, live in boarding houses, who end up in conflict with the police. Some of that testimony I found really I'm sick to my stomach to believe that girls are put in that kind of, and young boys are being put in that position. What do we need to do in order to protect children if they're having a run-in with the white police officers, if they're have to leave home to go to school? What do we need to do to make sure that they are able to live in society safely?
Mm-hmm. So I was fortunate enough to be in Mexico at this conference, and 3 countries, Mexico, Canada, and United States, and we have similar problems where it comes to sexual exploitation and human trafficking. And the discussion revolved around prevention, so how to prevent. So there are programs that are needed, and then also exit programs, so programs to help once a person is exiting this kind of difficulty. So again, I think it goes back to making sure the resources are there, the programs are there, prevention programs and programs, first aid programs, and programs for people to exit if they're in any kind of a sexual exploitation type of situation.
Thank you.